We have discussed about the vata these abnormalities which can occur due to either the involvement of the other doshas or maybe the mutual involvement of the other organs of the or other dhatus as such. Now, the next is about the specific named diseases. In Charaka Samhita, you have Ashitir Vata Vyadhis, ET Vata Vyadhis. Sushruta has not given the number, but he describes about the description of the different diseases as such. And among the diseases, the first one is Vata Rakta. Now, Vata Rakta and Rakta Urta Vata, differences are not much as such. When we say Rakta Urta Vata, that's the initial stages of involvement of the Vata and the Rakta, where the doshas can be maybe separated easily. When the same becomes an established disease entity, where it has reached this level of sthana samshaya, and then the disease is named, that's called as a Vatarakta. Now, Vatarakta diseases do occur in patients who are Prayashaha Sukumaranam, those who are having a delicate constitution, Mithyahara Viharinam, those who do not follow the restrictions of the diet and exercise, Roga Adva Pramada Madhya Vyayamescha Ativirnata. Due to the other diseases, it can be resulted as a complication of other diseases, and those who do rigorous physical exercise, maybe sexual involvement, consumption of alcohol, it also can result in the Vatarakta. ऋतु सात्म्य विपर्ययात् स्नेहादीनां च विभ्रमात् due to these seasonal variations which are not normal or snehadinancha vibhramata. During the shodhana, the process of sneha and shodhana, if not done properly, it also can result in and abhyavayeta, those who do not indulge in the sexual activity, sexual celibacy. See, over involvement of the sexual activity as well as non-involvement of the sexual activity can both these can be a cause for vatarakta. तथा स्थूले, those who are obese, vataraktam prakupyati. Or the other specific reasons which are mentioned are hasti ashwa ustaihi gacchadaha anyeshta vayuh kopam yatah karanaihi sevidaihi swaihi. One of the important causes is moving on with the animals. In those days, people used to move on animals like elephant, horses, or maybe the camel, etc. Now it's about the two-wheelers, those who ride on the two-wheelers or maybe who travel on automobiles. Now you have automobiles. In those days, there were no automobiles, but they were the living mobiles, the animals which were used as movables. These instruments for movement. And due to that excess of movement over these animals, it can result in Vata Prakopa, and that Vata Prakopa can result in Tikshna, it also can occur due to Tikshna Ushna Amla Kshara Shakadi Bhujjihi. They are, it can be due to the diet, consumption of spicy diet, or having the Ushna Guna, more of heated gunas, Ushna gunas, that also can result in Vatarakta. Or Santapadhi Bhuyasa Sevdeshta, due to exposure to severe hot environment, exposure to heat as such, क्षिप्रं रक्तं दृष्टिमायाति तच्च वायोः मार्गं संवृणद्धि आशुयातः क्रुद्धः अत्यर्थं मार्गरोधात् स वायुः अत्युत् उद्रिक्तं दूषयेत् रक्तम् आशु. Now, all these precipitating factors or susceptibility factors can result in involvement of the vata, rakta, and it can result in impairment of the movement of the blood. The rakta movement would the vessels will be reduced due to blockade by the vata, or there is an abnormality of the blood movement as such. And as a result of that, it results in a situation where the vessels, blood vessels will be blocked. Kruddho atyartham margarodha. There will be a margarodha, blockade of the vessels. तच्च संपृक्तं वायुना दूषितेन तत् प्राबल्यात् उच्यते वातरक्तं तद्वत् पित्तं दूषितेन असृजा आक्तं श्लेष्मादुष्टो दूषितेन असृजा आक्तः. Similarly, there can be involvement of kapha also. It's not only the vatarakta, it can also be kaparakta as such, though it's not mentioned separately. So there is a situation where the blood vessels may be blocked. Now, In the present day situation, we know about the circulation and why the blood keeps circulating. The major three factors which keep the blood in a proper circulation is one is the condition of the blood vessels. The blood vessels will have a smooth mucosa which is non-wettable, and hence the platelet aggregation doesn't occur. The other is the laminar blood flow. When the blood flows in the vessels, it's a smooth flow, and there will be no turbid flow, and those turbid flows are called as eddies currents. Because of that smooth flow, the cellular substances will be in the center, the fluid content will be in the periphery, and hence the chances of a platelets aggregating to the mucosa will be lesser. And the other is simply the viscosity, the ratio between the cellular components and the fluid component is maintained at such a level that there will be no further clotting. So for the clotting to trigger in clotting factors, the whole clotting factors which we know, 13 clotting factors, the to trigger in, there should be initially the breakdown of the platelets and release of the prothrombin. The whole process of clotting is mentioned as a prothrombin converting into thrombin, and then it becoming a polymer and becomes fibrin and fibrinogen and fibrin. So that sequence of conversion of a soluble substance prothrombin to a insoluble substance, the fibrin is the mechanism of clotting, where you will have many factors which are coming together and stimulate that. Now, among those factors, the three important conditions are the viscosity of the blood, laminar blood flow, and then the condition of the vessels. Now, if at all there is any abnormality of these, like if there is a hypercoagulability, which can occur due to either any of the drugs which are given, or it could be due to these abnormalities of any metabolic abnormalities, dehydration, where the fluid content could be lesser, or in conditions like malignancy, pregnancy, and so on. In these conditions, there could be a hypercoagulability, and because of that hypercoagulability, it can result in a clotting as such. It also may be produced due to a hypercoagulability, also could be triggered due to autoimmune diseases, many of the autoimmune diseases, or it can be even a complication of inflammatory conditions of the gastrointestinal tract. So multiple causes can impair the coagulability of the blood, or it could be the vessels, blood vessels could be damaged. Of course, it's known that the smoking like factors which tend to damage the mucosa of the vessels can result in the deposition of abnormal substances over the mucosa, and it becomes rough. Hypertension results in atherosclerosis, where there is a deposition of echiroma over the mucosa, and the mucosa becomes abnormal. Or inflammatory pathologies, which you call as a thrombophlebitis, so on and so forth, or simple damage to the vessels, physical damage to the vessels due to maybe injection of drugs, or maybe the injury of otherwise. Or it could be simply because the circulation has become abnormal. Circulation can become abnormal, or there could be eddies currents, turbid flow, if there is a obstruction to the flow or sudden dilatation of the vessels, as in case of aneurysms of the vessels, or in case of varicosities, where there is a structural abnormality of the vessels, there is a sudden variation in the pressure, and that sudden variation in the pressure can result in a turbid flow. Or it can be simply because a person is not moving at all, like in a post-operative period, post-purpurial period. Patients who do not move at all uh, in the after the surgery, or due to any other disease where the movement is reduced, simply the muscles are not contracting properly, and that muscular pump is essential for maintenance of the venous circulation. And if the muscles are not contracting, it can result in a vessels thrombosis or clot formation. So all of them could be a cause for the thrombosis. Now, the important is a comparison of what Sushra has said about the pathology of the blood flow being obstructed and what we know now. Sushra has said like it could be the multiple factors like diet and movement, and maybe lack of movement, which can result in an abnormality of the content of the blood, and that results in a blockade or by the vata, and then it becomes result disease is what we call as Vata. So Vata is not only the arterial vessel. Now the other difference is in the present day situation we consider arterial blockade and venous blockade as two separate entities. Thrombosis, arterial thrombosis and venous thrombosis are considered as two separate entities, and because of there is a difference in the consistency or some course of the disease. Whereas from Sushruta's point, or Ayurvedic point of view, both of them are the different phases of Vata, and the certain basic principles of the treatment remain the same. That's what you practically see in case of the varicose veins, or maybe our deep vein thrombosis, or maybe the arterial thrombosis. Our treatment will be the same. It gives the results. That's all the important. It gives the results. Though there is a significant difference in the clinical symptom as such. So that's about the importance of Ayurvedic principles. Now, among the different causes which can produce these arterial thrombosis or this abnormality of the vessels, now we know in the present day situation the causes which are discussed are mainly the traveling, and the traveling can result in what we call as the travel to the area, and then it can result in dehydration, the climate changes, or simply immobile, keeping immobile, traveling in a flight in a low pressure condition, and sitting immobile for a long duration, consumption of alcohol or coffee, all these are known to be the cause for the arterial thrombus or venous thrombosis and can result in the complications. Clinical symptoms which are produced due to the Vata when the blood vessels are blocked are Spashodigno, Todabheda Prashosha. So there is the first of the symptom would be there is a hypersensitivity. The moment the patient touches the part of the body, there will be increased pain. So sparsha udvigna, touch intolerance. That is the exact translation. And where the patient may have a hypersensitivity or hyperesthesia, and it could be even presented with pain to the hair or prashosha. It can also result in atrophy or swapa, a numbness. The sensation could be affected. Now, this is a very characteristic. Initially, there will be irritation of the nerve endings, and hence there will be more pain. That hyperesthesia would be the symptom. Later on, as the nerve endings are starved of blood flow, it can result in anesthesia, numbness, or paresthesia. There would be an altered sensation. And then in due course of time, it can even result in the pressure, atrophy of the muscles. Vatartena padau, Pitasubhyam, Bugrahu, Bhavaitam, Atyatosno, Tashopuducha. That could be even the other way, like there could be inflammatory changes where there could be severe temperature, local temperature may be raised, signs of inflammation could be there, the color could be reddish, Kandumanto, Shrushito, Sasho, Venus, those restless stability, or the course of the disease, it can result in itching or maybe temperature being reduced at the area, and numbness could also be presented. All these could be survey station there could be different clinical perceptions of the disease as such. Now, this is again absolutely something which we can demonstrate clinically. What are the changes or the causes as we know about these variations are once there is a impairment of the circulation, depending upon the degree of impairment as well as the course, like whether it occurs suddenly or gradually, the changes which occur in the body would be different. If the blood flow is reduced gradually, slowly, then there would be a temporarily the reduction of the blood flow to the area, and when there is a reduction of the blood flow to the area, the tissues at that area would be starved of or maybe having lesser than optimum oxygen supply. When there is lesser than optimum oxygen supply, many of the tissues they can shift over to anaerobic metabolism, from the aerobic to the anaerobic metabolism. Now, whether a tissue can shift to the anaerobic or aerobic metabolism would depend upon the different natures of the cells. Like a nerve cell, it doesn't have an anaerobic mechanism at all. So if it is starved of the oxygen, immediately there would be gross changes in the nerves. Whereas the muscles will have an extensive capacity to shift over to the anaerobic metabolism, and because of that, they can survive in an anaerobic environment for a longer duration if the blood flow is obstructed gradually, slow of this obstruction. Now, if it is the nerves, it's the nerves which tend to get affected first because they do not have a mechanism of anaerobic metabolism, and hence, the moment there is a reduction of the blood flow, there will be pain, hyperesthesia as such. Now, that's a very common experience. If you sit in a position for a long duration because of the pressure applied over the buttocks, you will have some irritation, pain. Then you tend to change the position, and that pain is due to the nerve endings. That's because due to that pressure over the buttocks, you may have a reduced blood flow to these nerve endings over there, and hence that produces a pain. But the moment you change the position, the blood flow may become normal, and you may not have that sensation at all. So, in the normal situations also, these nerve endings getting irritated due to the impairment of the blood flow, they do occur, and they help in reversing the pathology, or they would not allow the pressure or the changes to go into a pathological changes as such. That's the normal situation. But if the blood flow is not recovered at that moment, then there will be accumulation of intermediary metabolic products, lactic acid and so on. Due to this accumulation of the metabolic products, which are acidic in nature, they tend to produce the pain in the other structures also, particularly the muscles. Now, when the muscles do exercise like walking, the amount of oxygen utilized will be more, and it will be utilized converted into anaerobic shift over, and in the anaerobic metabolism you will have these acidic substances released, and these acidic substances will produce the irritation to the nerve endings in the muscles, and hence there will be a pain in the muscles. And the moment the and in if the is the ischemia is moderate, then in that situation, the muscles, the if you stop the exercise, if a person stops the exercise, there will be again flushing of these acidic substances, and hence the pain will be relieved. So that's the in next stage. And during that stage, there will be pain on exercise. When the patient does the exercise, there will be pain. But if the patient relaxes, if the exercise is stopped, there will be relief of the pain. And this is what we call as the intermittent claudication. A claudication is the term used for that, where the pain is felt intermittently. Now, if the condition is still progressing, if it is a slow ischemia and then it is still progressing, there can be two forms of the changes. One, the tissues, they may tend to adapt to the situation where the blood flow is lesser. And adaptation could be by two ways. One, by increasing the blood flow, or by increasing the number of blood vessels, that there will be angiogenesis. New blood vessels are being formed at that area, and maybe by having that new vessels over the area, the tissues may recover, or at least what we can see clinically would be, clinically there would be some abnormalities of the surface. Or the other way of adaptation would be, adaptosis could be of two sorts, either by a remodeling of the vessels may be remodeled and new vessels could be formed, or by replacing the tissues which need more oxygen by tissues which do not require an oxygen, or which can survive in a hypoxic condition. Fibrous tissue is one which can survive in a very critical conditions. The amount of the oxygen required by the fibrous tissue would be lesser, whereas the elastic tissue of the muscles would require more oxygen. Fat tissue would be somewhere in between. Now, the body will be trying to reduce those tissues which require more oxygen, like the muscular tissue or adipose tissue or the skin tissue, and replace it by the fibrous tissue. And that results in muscles atrophy, the lipolysis, the fatty layer of the skin will be lesser, the growth or the rate of growth of the skin will become lesser, like the epithelial tissue. The formation of the epithelial tissue would be slowed down, and hence you will see the changes which are typical. The skin changes, where the skin becomes glossy, hairs will be lost, sweat glands will be lesser, and the muscles may become atrophied. The bulk of the muscles may be lesser, the shosha which occurs as such. And if it is continued further, it can result in a situation where the patient may have a pain even during the rest condition. Now, that's simply because the amount of the oxygen supplied to the muscles would not be even enough to maintain the metabolism at the resting condition. See, when you say intermittent claudication, it's because the supply is not enough to maintain the oxygen supply during the exercise, but later on it can result in the rest pain conditions. And then, if it is further severe, it can result in a gangrene, the tissues may become dead. So, that's how the changes would occur. Or if the obstruction is sudden, suppose if the blood flow is stopped suddenly due to any of the pathology, then there could be initially stasis. The blood flow will be resulting in a dilatation of the vessels. Sudden blockage of the blood flow will result in a dilatation of the vessels, and hence there will be local signs of hyperemia. Now, as in case of chronic hyperemia, that's the chronic hypoxia, where the blood flow is gradually reduced, you'll see the signs of pallor. The blood vessels will become now because the blood supply is lesser to the tissues, the area becomes pale. The reflexes, venous reflexes or arterial pulsation will be lesser. Whereas in case of a sudden pulse this blockade, immediately there will be stasis of the blood, blood will not flow, and hence there will be local hyperemia. And the immediate next would be because the tissues cannot adapt, there is not much of enough time, the tissues become gangrenous. So there will be an acute gangrenous situation. Now, that's exactly what we consider as a either the Vataja, Kaphaja or Pittaja Lakshanas. In case of a chronic ischemia, very chronic ischemia, where the limbs will become cold and then pale, that's the typical sign of a Pittaja. Oh, sorry, Kaphaja Lakshanas. Kaphaja Vatarakta or Kaphadika Vatarakta. If it is an acute gangrenous changes, acute ischemia, you will have the Pittadika Vatarakta Lakshana, where there will be local signs of hyperemia, and then it can result in a gangrenous changes or sudden gangrenous changes. Or in case of the intermediary, somewhere where there is a numbness and so on, somewhere intermediary, that's the sign of Vatadika Vatarakta. So clinically, these ischemic changes now can be identified with these doshas. Of course, now in the present day situation, we attribute it to the rate of this impairment of the blood flow and the tissue's capacity to adapt. Adaptation capacities and rate of the impairment of the blood flow are attributed to that difference in the clinical outcome. Whereas from Ayurvedic point of view, we consider it to attribute it to the dosha environment. Practically, it is the same. There is no difference. It's only about the expression, the language. Otherwise, the principle is the same. Like an ischemic condition can present with the different courses, and those courses are explained by how the body reacts to the ischemia. We use a different term, whereas the contemporary science uses a different term as such. Now, the course of the disease will be pragrupe, shithilau, swinnau, shitalau, saviparyo, vaivarnya, those sukti, gurutva, osha samanvitau. The pragrupa, the pururupa could also occur in the presentation with the initial reduced strength of the muscles, shithila, and the swinnam, there could be altered sweating. See, if the ischemia is long prolonged, the sweating will be lesser. Whereas if it is in the initial stages, due to the stage of irritation, there will be more of sweating. The sweat glands tend to react to the ischemia by increasing more of the sweating. Later on, it becomes shita, the area becomes cold. Cold links would be, or saviparya, it could be hot. Now, that's exactly what we say, shitala or saviparya, svinna or aswina. So, it could be both the ways. And vaivarnya, there could be discoloration or suptatvam, altered sensation, or gurutvam, heaviness, or osha, local temperature being altered. Now, typically, most of the times, when the peripheral blood vessels, particularly the arterial vessels, are involved, it's the terminal vessels, narrow vessels, arteries, which are involved first, and then they tend to get to the proximal area. A clot formed in a minor vessel can result in this extension of the clot to the other vessels, and hence, majority of the conditions, you will see the ischemic changes in the extremities, like tip of the fingers. Then it tends to spread proximally towards the proximal side. Now, the same is described by Sushruta as a Padayoh Mulamasthaya Kadachit Hastayoropi Akhor Vishamiva Krudam Tadeham Anusarpati. The course of the disease is usually starts at the the padamula, that's the extremities, and then it tends to spread proximally. And this spread is compared to the poisoning by the rat, Akhovisham. Now, there is again a controversy whether the rats are poisonous or not. Majority of the rats which we see in the domestic conditions are not poisonous. There is no question about the poisoning by the rats, but it can result in the complications whenever there is a plague, bubonic plague. The rats become vectors to the bubonic plague, and the plague is always linked to the rats as such. Though not the rats being cause for the disease, but rats are linked to the spread of the plague. And in the bubonic plague, the typical complication would be again the vascular stasis, and hence there is a course, the typical presentation of that. And because of that, Vatarakta, the distribution of Vatarakta is compared to the bubonic plague as such. Of course, there is a general popular notion like Vatarakta being translated as goats. Maybe I am not saying that that version is wrong also, but the description which are mentioned in Sushruta, very specifically, they are very much specific to the ischemic changes as such. Now, the course of the disease, now we have, whatever I have discussed as the course of the disease now, the same is given in the form of a graph with what we can identify in terms of the laboratory findings or pathological findings. In case of that PAD present, this peripheral arterial disease present as such, but may not have a clinical course, clinical symptom. The causes are mainly abnormality like dyslipidemia, diabetes, etc., where the patient may have at that stage itself, if you go for the markers, these markers can be LPVA or APPLE-B. These markers can be now studied, and you can identify the patients who have a high risk of peripheral arterial disease even before the clinical symptoms can occur. Or in the initial effect, there could be thrombosis, inflammation, and mild oxidative stress. There again, you can identify them with these markers. Now, because we have more advanced biochemical tools, these can be identified at an earlier situation before the clinical presentation can occur. But once the clinical presentation occurs, it's the intermittent claudication, then the markers would be like the MPO or this PARS1. When it's a critical ischemia, at that situation, TMP1 is the most critical, or BGF. It's the most practical used conditions. And when there is a tissue death like gangrene, then fibrinogen or galactine, these could be the markers which could help in. Now, all that point is that is we usually in the routine clinical practice, we depend upon what we see clinically and then decide about the phase. But now you have the facilities or these laboratory assistants where these stages can be identified a bit earlier than the clinical. That's all the point. Anyway, that's about the course of the disease and then comparison to what Sushra has said. The prognosis can be predicted based upon the extent of the lesion and the involvement of the tissues. आदान स्फुटितं यच्च प्रभिन्नं प्रसुतं चेत् यद् उपद्रवेश्य यद्यस्तं प्राणमांसक्षयादिभिः शोणितं तदसाध्यं स्यात् याप्यं संवत्सरोचितम्. An acute ischemia, as I told, will present with the immediate tissue degradation and an extensive involvement. So, prabhinam prasutam and upadravesh dustam pranamam sakshayadivi. The severe toxemia can occur in case of an acute ischemia where there is a sudden gangrene as such. If the lesion is extensive up to the level of knee, now this is about the lower limb, similar issues can always compared to the upper limb ischemias, where maybe may extending up to the elbow, then the prognosis is poor. Whereas a chronic ischemia is a chronic ischemia where the ischemic changes are gradually occurring and it's persisting for a year or more, then it becomes a apnea. It can be pulled down, but it cannot be cured. The patient can be pulled down for longer duration. That's exactly true. That's about Vatarakta or peripheral ischemic diseases. The management of that will be in the Chikitsa Sthana. So we will be referring to more of the details of the peripheral ischemic diseases and their management in the when we discuss the Chikitsa Sthana later on. Next up, the disease which is mentioned by Sushra in the among the Vataja Vyadhi are Akshepaka. आक्षेपक is यदा तु धमनीः सर्वाः कुपितो अभ्येति मारुतः तदा आक्षिप्रत्याशु मुहुर्मुहुः देहमुहुश्चरः मुहुर्मुहुः तदाक्षेपात् आक्षेपक इति स्मृतः. When there is an involvement of vata with dhamanis. Now, the word dhamani again is often misinterpreted among Ayurvedic community. Many times the dhamani is translated as an artery, but if you go into the description of dhamani in Sharirasthana, the main functions of dhamanis are to regulate the motor activity or maybe to carry the touch sensations. Sensory and motor distributions are represented by the functions of the dhamani as described in Sharirasthana. Of course, when we go into the Sharirasthana, we can have more detailed description about this issue. So, for the present, that controversy, like whether dhamani has to be considered as artery or whether it is about the neuronal functions, we will not go into that level of controversy now. But majority of the functions which are mentioned in dhamani in Sharira, they represents the neuronal functions. For that, we will stop at that level now. More of that discussion will be when we discuss in the Sharirasthana. And due to the abnormal conduction of the impulses in the dhamanis, it results in repeated movements of the body, and repeated movements of the body akshepaka muhurmuhsadakshepat akshepaka dismutah convulsive disorders. Now this conduction of vata in the dhamani now can be identified with the graph, identified with the investigations and different investigations where you can have electrographs and then EEGs, electroencephalographs can be done. EEG can show you that abnormal activities, and we consider them as the seizures or convulsive disorders. Now, convulsive disorders could occur due to mainly two factors. In the whole nervous system, the nervous system is functioning with an inhibitory control and stimulatory control. Conduction of the impulses are controlled in such a way that there are some mechanisms in the hormones, neurotransmitters, as well as the total factors, multiple factors, which will reduce the pace as well as the formation of action potentials in some specific areas. At the same time, there is a mechanism of production of the action potential and facilitating. It is something like a very simple description would be an accelerator and brake present in a vehicle. And when for the normal function, you need both accelerator as well as brake. But if due to many factors, any of the factors, if the inhibitory functions, the brake fails, then that can be resulting in a abnormal conduction of the impulses and the seizures could occur. Or if the conduction of the impulses become more rapid, and hence there could be an abnormal this flow that also can result in the seizures. So seizures mainly are of two types. One, where there is a loss of inhibitory control or reduced inhibitory control, or acceleration, increased acceleratory controls. Very brief passage. In addition to that, a third factor is having an ectopic focus. If there is, see, conduction of the impulses in the nervous system is regulated in such a way that the impulses pass through a specified pathway, and the impulse, this occurs due to sequential production of the impulses. Action potentials are produced after the refractory period is over of one of the nerves, and then only it can become activated. But and so there is a sequence, regular sequence, synchronized manner. But if somehow that synchronization is failed, if there is an abnormal area of the nerve tissue which continuously produces the action potentials or which fails to produce action potential, what we call as blocks, it also can be a cause for the seizures. So seizures could be produced due to mainly the three factors. One, reduced inhibition or increased acceleration, and the third is focus, having some focus or abnormal tissue which continuously produces the impulses or stops the impulses. And it can occur in the cerebral cortex, in the thalamus, or any of the other areas. Based upon that, the seizures are classified as the generalized seizures when it is involved the cortex, or what we call as epileptic focus, where the patient would have the tonic and clonic stages of presentation, or it could be focal, like it could be limited, partial epilepsy, and so on, or absent seizures. Depending upon the area involved, the clinical sequences are different. So we know in the present day situation, convulsive disorders are categorized as one convulsive group or seizures, and then you have the groups like a generalized tonic convulsion or grand mal pathologies or petit mal pathologies, motor pathologies, or partial seizures, and so on. The differences are there. From Sushruta's point of view also, Akshepada is about the generalized conditions where the patient would have repeated movements of the body, but there may not be a loss of consciousness in that condition. So, in a typical this abnormality, that's what I said, depending upon the area, you may have different types as such. Now, among the same, the so apasanaka samyoyah patati antarantara kafanvita bhrusham vayu taveva yadi tishtati. In the same conditions, if the patient may not actually have a repeated movements but just falls off, if the patient just falls off, and due to the involvement of the kapha, there may not be that rigorous movements. That's what we call as the petit malabsence or absence seizures. Absence seizures is where the patient may temporarily lose the consciousness, but there may not be the tonic clonic phases. That's called as a apatanaka by sushruta. Again, there is a slight difference in the nomenclatures and description of these conditions in Charaka and Sushruta. I will not go into that controversy now, but we just discuss about what Sushruta has mentioned. In Sushruta, Apatanaka is a condition where the patient falls, but there may not be a actual rigorous movement may not be there. Whereas, if the patient has a situation where there is a temporary rigidity of the body, Sadandavat Stambhaiti, Krichraha, if there is a rigidity of the body, and as a result of the rigidity of the body, the whole body takes the shape of the bow, that's the Dandapatanakaha. As the patient falls, that's exactly what you see is the tonic phase of the epilepsy. In tonic seizures, you will see that as such, and in that condition, due to the rigid body and there is a rigidity of the whole structures, increased activity of the muscles, patient may produce some sound which is called as epileptic cry. Due to the sudden contraction of the muscles, the patient may pass the stools or urine incontinence could be there. The whole body is arched like, and that's a dandapadanaka. And due to that involvement of the different muscles in that area, Hanugraha tada atyartam suvarnam krikshat nishevate. There will be spasm of the muscles of the oral cavity, and hence the patient would not be able to swallow. Now, we describe this as the situation where there could be epileptic cry, and one of the important complications which can occur during such a tonic seizure would be the patient may bite the tongue and the injuring tongue and aspiration. The patient is not able to swallow the food, and hence there can be aspiration. So one of the important first aid in case of the seizures would be to ensure that the airway is kept patent. So now we have more detailed description. Sushruta has mentioned with a very brief sutra that the patient would not be able to swallow. So annam krichami shevate. The swallowing reflexes are affected, and there is a spasm of the muscles, and hence because of the spasm of the muscles, tongue bite and so on. So that's what we have to extend the commentary. Then dhanustulyam namadhyastu dhanustam samyakah. If the same condition, when due to that tonic phase and when the bow-like arch is there, that's called as a dhanustamba. Anguli gulpa jathara hridvaksho galasamshitah snayu pratana manilah yada akshipati vegvan vistabdakshah stabdahnuh bhagnaparshvah kapamaman abhyantaram dhanuiva yada namati manamah tada asya abhyantarayam kurute maruto bari. Now, Sushruta has mentioned about the two Bahirayama and Antarayama. Now, Bahirayama is when the body is extended as such due to the conversions. Antarayama is body tends to get flexed. Now, this is a very unique feature. Majority of these epileptic seizures or tonic convulsions which we see would always have an extension of the body. The typical situation will be extension. Very rarely, the body would be flexed. Now, the reason is simple. The extensor muscles of the core of the body always are stronger than the muscles of the flexor muscles of the body. And hence, the majority of the conditions, you will have a situation where the patient would have a extension of the body as a Bahirayama is more common. Whereas rarely you come across an antayama, body would be flexed. Now, that actually, from the pathology point of view, that flexion or extension doesn't make much difference. The issue is about which of the group of the muscles are stronger. See, when both the muscles, extensor as well as the flexor muscles, go rigid, the ultimate position of the body is determined by the stronger muscles. The stronger muscle group will decide. So, in case of the core part of the body, it's the extensor muscles which are more common. Whereas in the limbs, the flexor muscles are more stronger. So, usual position would be limbs tend to become flexed and the core part of the body will be extended. Now, in some persons where the muscle groups are trained, or maybe due to some occupational factors, if some groups of the muscles are stronger, then the position adopted during the tonic convulsions may be slightly different. So that is the only description. But Sushra has made out that differences of the Bhashya Ayama or Antarayama. Bhashya Snayu Pratanasto Bhashya Ayam Karotcha. Tam Asadhyam. Sushra has said Bhashya Ayama is Asadhya. Prahu Vaksha Katyuru Bhanjanam. It tends to injure the bones of the body. That's true. The injuries of dislocations and fractures are more common when the body is extended because there will be lack of support. If there is a flexion of the body, then the body, the major weight carrying areas of the body still would have some support and the chances of an injury would be lesser. Now, Sushila has attributed the possibility of Kati Ur Bhanjana, fractures and other accompanied injuries, skeletal injuries during the convulsions to Bahyayama. That's absolutely true. Kafapitanito Vayu, Vayureva Chakevaraha, Kuryad Akshepakam Tvanyam, Chaturtam Abhigatajam. The etiology of these conversions could be either it could be Kapanmita or Pittanmita or Kevalavata. Now, when it's a Kapanmita, it's often presented as a the absent seizures. Pittanmita is usually presented with the tonic phase and that tonic seizures. Kevalavata is often presented with the abnormal movements, Jacksonian sort of epilepsy. Kaphanmita are the absent seizure. Pittanmita are the typical epileptic seizures, where grand mal epilepsy, where you have that the tonic phase and then the clonic phase, which occurs gradually. And then in case of the Vatanmita, Kevala Vata, it's the Jacksonian motor epilepsy. Kuriyad Akshepakam Tanyam Chaturtham Abhigatayam. It also can assert a Akshepaka also can occur due to Abhigataja, trauma. Now, trauma induced is not directly due to the trauma, it is due to the septic complications of the trauma. So, now in the present day situation, whenever a seizure occurs, you need to have a diagnostic schema, and that diagnostic schema would be you will have to see like when there is a seizure produced due to some stimulus or without stimulus. The stimuli and under could be causes could be either vascular like a cerebrovascular accident or toxic as in case of viremia, or it could be a trauma like in conditions or infections like these meningitis like conditions, or it could be a patient tetanus-like conditions or meningitis-like conditions also it can occur, or metabolic conditions like hypoglycemia or hyponatremia. These could be the causes for the seizures. All seizures or attacks need not be considered as epilepsy. Only when there is no underlying pathology, you will consider them as epilepsy, and epilepsy you will again have the generalized and the focal, the same issue which I have discussed. So, one of the important issue which Sushila has not mentioned would be you need to think of the other causes. Now, Sushila has mentioned Abhigataja as one of the causes, trauma, but the other causes we now have to attribute them. So, you need to assess these conditions when you see a case of patient with seizures. In addition to these, the toxemia, now particularly the toxemia, Sushil has mentioned about that toxemia, particularly the eclampsia of pregnancy. Garbhapata nimitascha, shonita atisravachaya, abhigata nimitascha, nasiddhati apatanakha. These convulsive disorders produced due to eclampsia or toxemia, which is garbhapata nimitaha, due to the abnormality of the placental reactions. When the gravidatorus and there is a toxic reaction with the embryo in the body, it can result in the eclampsia. Eclampsia of pregnancy is another huge issue. We will not go into the detail of that, where you will always have that hypertension as a major complication, and there could be fetal growth restrictions, and then it also can result in the multiple organ damage. It can be fatal if it is not identified early, and one of the major concerns in the obstetric practice, and that Sushra has said that it is a asadhya. Or Shunitatisravacharya, a convulsive disorder produced due to excessive bleeding or due to the trauma are considered as a asadhya. That's about the different convulsive disorders. Then further we'll discuss about Pakshavada, Pakshagata in the next session. So we'll stop today. If there are any questions, I'll try to answer the questions, and then right, there are no questions. We'll conclude today. We'll continue in the next session. Right.